welcome to Dr. Vibes. In this video, we shall study how to make an IV access.
How to insert a IV cannula into a vein. Now, the only difference between venipuncture and IV cannula insertion or a gel insertion is the type of vein we choose. As madam had told you, in venipuncture we choose usually the antecubital vein, but when we are going in for a IV cannulation, we usually avoid the joints because the patient will move his hand. The IV cannula will be there for a long time, and if the patient moves the joints, the cannula will be destroyed. So we will have to choose a long segment of vein. We usually choose this aspect of the forearm, the anterior aspect of the forearm, or we choose the dorsum of our hand, where we get a long segment of vein. As you can see here, there are some veins which are prominent and straight. We can choose them, or we can choose a straight vein like this, which will be beneficial. And you can clearly see the veins in this patient, or rather this mannequin. Patients are usually not so supportive, so they do not come with such beautiful veins. So you will have to search for the veins at times. Okay?
Just before inserting, sir has told you cephalic vein, basilic vein, dorsum of hand. These are the sites we prefer. We don't prefer over the joints. We inserting, so you get a long segment, so you get the proper access. When you have to, in some patients like chronic kidney disease patients, you don't go for channeling in the left hand, because sometimes the patient may need heavy fistula or procedures like that, or a patient going for subarachnoid hemorrhage, this patient needs DSA. So for that we need to access the left hand, so keep the left hand spared. For all practical purposes, we do not do channels in the lower limbs, okay, because there are certain complications that will come with it. There are maybe one or two indications of doing channels in the lower limb that we'll get to know in the medicine book. After that, so anyhow we have chosen the vein. The sterility has to be maintained. Explain the procedure to the patient. You will tie the tourniquet tight enough. Always when you are binding the tourniquet, you know the most important thing to do is, after doing the procedure, take out the tourniquet. Do not repeat the mistake. In medicine ward, you may be spared, but in pediatric ward, if the tourniquet is there, then you will be
matching up with a very young patient with gangrene.
Yes.
Why? Because the tourniquet will not allow arterial blood flow also. So ultimately, the patient will end up with gangrene. So remember to open the tourniquet before you go away from the patient.
So this again, this will be opened like this. This by insert the instrument is over here. It will be given to you in a sterile manner. We have the wings that we first stabilize. We have the cap over here, and then we have the. This is the needle. This is the needle, and this is the cap. Okay, these are the parts. So this one is a pink gel coat we are going to use.
প্রথমে জেল কোটাকে খুললে পার্টসগুলোকে একবার চেক করে দিলে,
Just check for yourself, because sometimes your pointer will come and they will take out the cap.
কিনা কোথাও কোনো ব্রেক আছে কিনা জেল কোটে সেটাকে একবার চেক করে নিলে তারপরে তুমি ইন্ট্রোডিউস করবে। ওকে,
So here also take the support of the wings, put your four fingers over there. You will have the bevel end upwards. You will ask the patient to clench his fist, prominence, so that prominence of the vein is there. Then
তোমরা স্কিনটাকে একটুখানি পুল করবে যাতে ভেন্সগুলো সরে না যায়।
exactly.
ওকে,
In elderly patients, that's why it is very important, so that you stretch the skin of the patient, and they will introduce the gel coat. While you are in the vein, also you will get a blood coming over the hump. So you know you are in the
right place.
You are in the right place.
Gradually push the gel inwards, but the needle continues to be there, though partially withdrawn. জেল কোটে সবথেকে সমস্যাটা হচ্ছে তোমরা ইন্ট্রোডিউস করার পরে ডাবল পাংচার করতে পারো। তাই জন্য কতটা ইন্ট্রোডিউস করবে, ব্লাডটা ঠিক হাবেতে আসার সঙ্গে সঙ্গে স্টপ, নিডলটা উইথড্রন হবে, তারপরে তো তুমি পুশ ইন করো, নিডলটা যদি কখনো থাকে it will result in a double puncture.
That I have retracted the needle outwards. So after you have the blood in the half, so you know you are in the vein, you put the needle behind and push the catheter forward. Okay, and obviously your tourniquet is here. You keep the hand over here, then you take out the needle, and then you put a cap. You put your hands over the vein, over the channel, so that take out your tourniquet, so that the blood will not come. Okay. This is how you will do a channel. After that, we get a lot of most of the times you will be given gluco and you will fix it by yourself. Sometimes you will get these things such as easy fix, and see, what I would like to prefer is that you will first fix the wings. Okay, first you will fix the wings. After that, fix the wings first. From the other side, you will put the adhesive. As simple as that.
So now that we have got the IV access, we have fixed the gel core, we will be proceeding for the therapeutic modalities for which the gel core has been inserted. The most common among them are intravenous fluids, prior to that intravenous injections, and at times blood transfusion. Okay. The procedure for creating an IV access, that is putting in a gel core, and IV drug administration is the same. Put the tourniquet, choose the vein, palpate the vein, clean up the area, inject the needle, put in the needle, see whether blood is coming out, and then you push in the drug. Simple.